Hey everybody, it is now day 2 in the hospital, and we're just, still here. Harrison is currently asleep. Curtis is watching soccer on his phone. And I'm just sitting here on this little makeshift bed that I have, watching TV, playing on my phone, and eating these amazing little pretzel caramel chocolate snack things that we got from Costco. And I can't stop eating them. And the crazy part is they actually have dark chocolate on them, and I hate dark chocolate. I think it's disgusting because it's too bitter and it's just not very good. I like my sugar and my milk chocolate and my sugar versus dark chocolate, but these are amazing. You have to go buy them. They're from Costco, and it's the Snappers brand, so if you have Costco membership, go get these because they are amazing. So I've been eating them all day, yesterday, all the time. Anyways, so I just want to do an update on Harrison and let you know what's going on and what the plan is for the next couple of days. So I stayed the night here in the room with Harrison last night, and it was pretty rough. He had a hard time. He essentially kept getting woken up once an hour throughout the night from things like getting his medicine, getting his antibiotics, vitals, and then we're sharing a room, so anything going on with the baby next door, so just kept getting woken up. But so that it was a hard night on him. Around 6 in the morning, he ended up getting a dose of morphine because he was in a lot of pain. He had a dose of oxycodone and Tylenol, but he was in between doses and his pain was just a little high, so he ended up getting some morphine, and that calmed him down enough that he was able to sleep. So he slept for a good 2 hours from about 6 to 8, and I believe it was interrupted. I didn't wake up during those 2 hours, so I'm assuming he didn't wake up either. And so during the day we've just been still working on his pain management, and he's still in pain in between doses. The nurses told us that his oxy prescription has changed. Before he would get it every 1 dose every 6 hours, and now he gets 1 dose every 4 hours, and so that lowers the time frame of, essentially, how do I put it, that open block of time where the Tylenol and the Oxy aren't working. And so now everything's closer together, and we can kind of keep up his pain meds, and we don't have to worry about that 2 hour block of time where he's in a lot of pain. And so I think that'll definitely help him out a lot tonight. We'll see how that goes, and see if he's able to get longer stretches of sleep tonight, unlike last night where he was woken up every so often. The good news is tonight he doesn't have to worry about getting an antibiotic because he's officially done with his antibiotic. So he still has the IV in his hand, but it's only for medicine doses, so if he needs morphine or anything like that, then that's how he'll get it there. So we're hoping we're hoping that tomorrow there's the possibility that we can look into getting his drain taken out of his head. If not tomorrow, then that could happen Friday. Today's Wednesday, so tomorrow would be Thursday. And then if it doesn't happen tomorrow, then it would happen on Friday. And then as soon as the drain is taken out, then the day after, the dressing on his head can get removed. So I'm hoping that we can get the drain removed from his head, because it's a bit of a pain dealing with when you're trying to like pick him up and hold him, because you know the drain is heavy and it's literally pulling on his head, and so you have to watch that along with all the cords that he's connected to. And so it'll be nice once that is gone, because then we can focus on holding him more and cuddling with him more without having to worry about a drain getting pulled out of his head if it gets caught on something. Harrison's pediatrician came and saw him this morning. His pediatrician was the one who caught his craniosynostosis at his 4-month appointment, because his pediatrician actually had, or was actually born with craniosynostosis too. And he said that when he was an infant, he had surgery as well. And he said that at the hospital in the city that we live in, he was the first baby to actually have it done at that location. And so so he caught it on Harrison, and oh, he's waking up a little bit. But anyways, his pediatrician came and saw him today, and he brought him a little gift. He got a little koala bear and a card that he had written a little note on. And so Harrison has been cuddling with the koala bear. His name is Oscar, and I think Harrison and Oscar are going to be best buds, because he's just the cutest little beanie baby stuffed koala, and it's super soft. So hold on 1 minute, I'm gonna go get him. So Harrison, when he wakes up, he's pretty vocal and kind of whines and whimpers, and sometimes he talks to himself. So he started to wake up and was whining a little bit. So I worry that he's you know, in pain or you know, hungry, anything like that, because his appetite has gone down from what he normally drinks. You know, he's drinking half of a bottle in comparison to what he used to drink. So I just don't want him to go hungry or anything like that. But the drugs aren't, the drugs will suppress his appetite and make it so he doesn't want to eat as much. Same with the pain. So, but let's go over and go see him. Okay. Hey, buddy. Alright, so Harrison's eyes are both swollen shut. The left eye is the most swollen. He can kind of open his right a little bit, and kind of is disorienting to him, so he whines a little bit more. We have a vibrating tube that just kind of circles around him. We've noticed that the vibration on the bed has kind of helped him out a little bit, has calmed him down. And then we still have his white noise machine right there. And then here is the little bear, or the koala bear, that his doctor brought him. So he's just been cuddling that today. Yeah, I know, buddy. But, you know, this is what the day's been, or, you know, this is what we've got Harrison set up like. He's, you know, we're just trying to let him sleep as much as possible, trying to keep him comfy. He does a lot of, you know, rubbing his face because he can't see, he doesn't know where he's at. And so I go up to him quite often and touch him and make him aware that I'm there. and so I've held him a couple times today. Honestly, I haven't held him very much because I don't know how much it hurts him, and so it's easier just to kind of let him lay down in the bed, especially when he sleeps, because he just sleeps soundly without waking up or, you know, moving or anything like that. He's able to, look at this. Okay, he stopped. He was actually playing with the IV on his hand, and he was playing with it and bringing it to his mouth, and it was really, really cute. But anyways, I just want to give you guys all an update on Harrison and how he's doing. You know, we're still working on trying to get his pain under control, get him feeling comfortable. He has his moments where he's perfectly fine, and then, you know, there's moments like these where he starts to get a little whiny and doesn't feel as good. But other than that, he's still doing fairly well, and I'll be staying here at the hospital again tonight with him, and Curtis will be going back to the hotel. I was able to take a nap this morning, and so I'm feeling, you know, I'm tired, but I'm not exhausted, so I'll be fine to stay with him tonight. And I feel more comfortable with staying with him anyways. But so I'm going to I'm gonna go relax for the rest of the night and try to console Harrison, and I will keep you guys updated on how he goes. Check back tomorrow for day 3, and hopefully I'll have some news on getting his drain taken out. But thank you for watching. Have a great night. Don't forget to like, subscribe, and follow, and I will see you all tomorrow. Bye.